July is Minority Mental Health Awareness Month. Mental health is something that isn't often talked about in the Black community, but it should. In fact, it's important for everyone to talk about it. Dr. Ericka Pinckney is one of the co-founders of Black Therapists of Central PA, and she's here to talk more about this important topic. Dr. Pinckney, thank you so much for being with us today.
Sure.
There's so much that I want to talk to you about. I just am so happy that you're here because mental health is very much in the news right now. And just as a broad perspective about mental health, we've been talking about so many devastating events, including mass shootings, the school shootings as well. And we're hearing a lot about how important it is for mental health to be addressed. Can you just talk a little bit about why that is such an important topic?
It's an important topic because, like you said earlier, there's been stigma attached in the past. You know, people worried about, will I be viewed as crazy, or well, I don't want people to know, I don't want to judge, or I'm experiencing this in silence. And our mission is to help facilitate those conversations and encourage people to take those steps. There's resources out here, and you don't have to suffer in silence. We want to remove the stigma and offer those resources to you to be able to get the mental health and the mental health support that you need.
And as we've been talking about for the past several months now, when it comes to like mass shootings, and they're talking about increasing access to mental health. Is there something where, as a therapist, do you see that that is something that is needed, and that is something that you could see warning signs that people were being better treated?
Yes, absolutely. One of the reasons why we created Black Therapists of Central PA was to be able to bridge that gap between community access. So in our directory, even though we have lots of different clinicians, there's still barriers. One, to access. We have clinicians who have waiting lists up to 30 people, or they may not accept your insurance. So there's still those kind of barriers out there, but we at least are packaging together. Roseanne Johnson and I are the co-founders, putting this together to be able to make it not as uncomfortable. And again, not something that you have to go out here and search hard for. We want to give you access to be able to make that process an easier and smoother process for you.
And just talking about the news as well, something that happened earlier this week here in Harrisburg, on Monday during the 4th of July, the fireworks. We saw the chaos that came out west. People were running through the streets there as they thought that there were shots being fired, and the police said it actually turned out it was firecrackers, but the chaos that you saw there was real. Can you talk about, if people were out in this, especially children, how that could be, what should people be doing, because this could have a lasting impact on them?
Not minimize it. You don't want to just be like, oh, okay, just go to your room, you know, or just, you'll be okay. You know, one of the clinicians, she's featured on our website, her name is Nikisha, and she's actually offering a free Zoom this week for parents and families who were downtown this weekend, and over the week, and to be able to talk to them and offer those resources to be able to have those conversations with your children. And you know, children, adults, young people, teenagers, a lot of people were in fact affected. So you want to make sure that, you know, you don't have to just sit and ponder with it. Talk to someone, express those feelings. You might be experiencing nightmares, tremors, all kind of things associated. If there were triggers for you, if this was a triggering event, if you had some type of pre-existing trauma, then that could have been re-traumatizing. So definitely taking the time and the space to be able to work through those emotions and feelings with someone who's professional, but also your natural resources as well. Don't, you know, isolate.
And this being Minority Mental Health Awareness Month, can you just talk about the importance of why, for the Black community in particular, that it is hard to reach out for help?
Yes, I think sometimes culturally it could be, you know, we're strong, you pray about it. We encourage people to, you can pray, you can do whatever you need to do, but therapy is also an option to you. You can do both. It doesn't have to be one or the other. So I think now that that conversation and some of that stigma, the unveiling of that, it's a holistic approach, and it's okay to get what you need. And again, that's why we're here. And I'm so thankful to you all for allowing us to come here and share about these resources and how people can, we want to bridge the gap. So we don't want it to be the community here. I mean, it's the tags on social media. Just yesterday, you know, we're tagged in social media posts. That was like, well, why don't we take that? If the community is saying they need it, let's create it. Let's make it accessible.
And that's what you did, and you created this organization where you can find them all, basically like a one-stop shop where you can find these therapists. Give us the website.
Yes, it's blacktherapistofcentralpa.com. Yep, blacktherapistofcentralpa.com, and there's up to 40, we have 40 41 clinicians are listed right now, but our network is not closed. So if you're not on there, we want you on here. Because again, there's so many people and there's so few of us. Even with 41 identified clinicians on our website, the need is still great. So we intentionally waited to do our press release and pair it with Minority Mental Health Month so that, again, there's initiatives, but here we are in local central Pennsylvania, we're speaking to that need.
Very good. Dr. Ericka Pinckney, thank you so much for coming on and telling us about your very crucial service that you provide to our community. We really appreciate your time.
Roseanne and I, it's our pleasure, and we'll continue to do this work for the community. So thank you for having us.
Thank you so much.